Very good. 138 over 72. Any dizziness today?
No,
No. How's your breathing been?
very good.
Any shortness of breath?
No.
Nice deep breaths.
5 years ago, I had colon cancer, and after I got through rehab, I had the Gvna come to the house. Then in 2010, I had cyst removed from my sternum, and when I got back out of rehab for that, the Gvna came to the house, and then this year, 2011, I had congestive heart failure, and when I got out of rehab for that, Melissa was here.
It's not just the direct care that we provide the patients in the home. A lot of the nurses on staff, we go above and beyond. We work directly with the wound care clinics, with the anticoagulation clinics, and with the physicians' offices to get the patients the medications or the services that they need.
I felt like that's who I wanted in my home. And I know I made the right decision from the moment they came in. It was just wonderful care, wonderful service that I received, very caring, very knowledgeable, always made me feel as comfortable and as safe as possible.
I couldn't believe not only that they did all these things, but the feeling of security I had for having them done right here.
After giving birth to my son in 1998, I was diagnosed at that time with cancer. And so I had to have my son early, and then immediately started aggressive chemotherapy for my cancer, which pretty much weakened my system to the point that when I would come home, I needed VNA services at that point to assess the situation and keep me going.
When I found out I was pregnant, my Healthy Families worker came and met with me one-on-one, so it was private, so I didn't have to worry about people being around, and she comforted me and let me know that I wasn't alone. I mean, I had a significant other, I had family, I had friends, but someone outside the box being there for you, taking you step by step through a pregnancy, especially your first one at such a young age, I mean, it was comforting, and it was really helpful to have someone there for me throughout the whole pregnancy, from the beginning to the end, up until now.
The Gvna VNA has been very helpful with all the services, from the daily care up to the nursing. We get wound care. I really have a skinny leg.
Chicken legs.
And my therapist is just as thoughtful and goes overboard to make sure that I get the best possible therapy when she's here.
So try and just be conscious of that, where we switched it over to this kind of stocking. Check and see. When I pushed down on the side, it actually stayed indented where my finger was, so that means there's a lot of swelling in there right now.
I can see it right there.
Yeah, yeah, right there. All right.
Back in the early 90s, I had a major infection in my low back and part of my sacrum. And being an occupational therapist, really didn't know much about home care, and was hospitalized for about a month. So my first introduction was when I became a patient here at the VNA. I had nursing, physical therapy. It was pretty humbling to come in on the other side of the fence and be a patient versus a clinician. Not being able to walk, having a lot of pain, putting a lot of myself out there to the clinicians that were treating me, because I had no idea really what was going on or what my outcome was going to be. So 18 years later, I still sit here as a clinician, the director of the rehab department, with the same physical therapist who treated me being on my staff.
I had a total hip replacement in September, and I came home and I was in total agony. Couldn't do anything. And Steve LeBlanc, who is one of the physical therapists at Gvna, came. And the reason I chose Gvna is because I have a very close association with it. My mother, Esther, was one of the VNA nurses way back in the 50s, I guess. And she loved the Garden of VNA. She loved to go to people's homes and with babies particularly and elderly people.
Letty, how's your appetite been?
Good.
Yeah? You eating lots of different foods?
Yeah.
Let me see your mouth. Looks a little white. Were you drinking any milk?
No, I just rinsed it out with mouthwash.
Okay. Very good. So let me take a look at your feet right now, okay? You do have some swelling down there right now.
Yeah.
And they are dry, dry, dry. Really important with your diabetes that you take good care of your feet, okay? Lots of lotion.
I was reading the directions and I noticed it said don't put the lotion between your toes.
Between your toes. Because you know what? You don't want it to get too moist in between the toes.
Yeah.
Yeah, because then it can break down. Good. Think low numbers.
When my daughter was born, well, actually, my Healthy Families lady was one of the first people I called. I was so excited. And she, you know, it was cool to be able to call her and say, oh, you know, this baby that you kind of coached me through to have is finally here. And that alone was exciting. It's almost like I had a friend that understood what I was going through. And so obviously she came and she met my daughter, and they give you a lot of helpful tips, like, you know, is your baby crying through the night? Is your baby waking up? Like, this is how you can stop, this is how you can help it, this is how you can soothe it. And a lot of it worked. Like, if my daughter would be crying at 3 o'clock in the morning, I would think of something that my Healthy Families lady had told me, and I would do it, and she'd be sleeping in 5 minutes, and it was just awesome.
The team of nurses and the doctor who was totally in charge of the program, they all met together on Wednesday mornings, went through every single case individually so that everyone on the team knew exactly. They may not have ever seen the person before, but they understood the medical situation, they understood the medications that were being issued and the additional care that was being given, so that each time someone new came into the house, they weren't new. You know, they knew the case, and that made us feel very, very comfortable.
The nurses and the physical therapists work very closely together. They communicate on almost a daily basis as to the patient's progress. The nurses also work really closely with the home health aides to make sure that the plan of care is being followed and that the patients are getting the care that they need.
As we go forward and the Garden of VNA adjusts to the requirements of healthcare reform, we're excited to be in a position to be a very strong community organization. We have the knowledge and the flexibility to adjust to the needs of the community. That includes adjusting and caring for individuals with long-term diseases. That includes caring for new babies, new moms, helping them at the beginning of life so that we can assist them in raising a healthy family, as well as working to assure that at the end of life, the best care is delivered. We are very vested in working with other providers in the community to assure that the best possible care is provided to individuals in their homes.
All I had to do was pick up that telephone And all I had to do was say my first name. They knew it after a while. So yeah, a great peace of mind.
I would recommend Gardner V&A because they are definitely helpful when you are struggling to be a young parent. You're not alone. You know that you have support and guidance, and it brings other people who are in the same situation as you together, so you know that you're not the only person going through this type of situation being such a young parent.
I'd recommend the Gardner visiting nurses to anyone who is confined or even partially confined to their home, to get in touch with them. They're just unbelievable.
My mother-in-law has been a patient here. I have had co-workers and friends, myself in particular.
I would recommend the Gardner V&A because the staff here is very professional. We're very timely. Most of us are very experienced in the medical field, and we can pick up on your problems a lot faster.
It takes a special person to be able to go into someone's home and make them feel comfortable. And I think the staff that we have working for us are all extremely diligent and hardworking, and the goal at the end of the day is to make people feel comfortable with us coming into their home and providing the excellent care that we all do.
I, as a nurse, continue to be very passionate about the care that we provide and very vested in the community. I too come from this community, and I feel that as we help individuals remain in their home, it's really important for the health of our community that we work together to accomplish this.
I am very gratified by the many donations that we receive throughout the year. Some folks are our patients who are grateful for the care that they have received, or loved ones who, upon the death of an individual, make tremendous memorial donations. We also receive great support from corporations and businesses in our community, which is a great sign to us of the esteem in which they hold our agency.
And it's wonderful to be able to say that the Gardner V&A is totally vested, from the board of directors to myself, as well as to all the staff providing the care, that they are vested in providing the best care to individuals in need.